Video 34, Project Management Tools, Gantt and PERT, Area 3 MCHES Subcompetencies 3.3.2. Review the learning objectives for this video. Alright, let us talk about some tools that are going to make your life so much easier when you are managing a health education program. Gantt charts are one of the most commonly used project management tools in health education, and they appear regularly on the Master Certified Health Education Specialist exam. A Gantt chart is a horizontal bar chart that displays project tasks along a timeline. Each horizontal bar represents one task or activity, and the length of the bar shows the duration of that task from its start date to its end date. When bars overlap vertically, it means those tasks are happening at the same time. This visual layout makes it easy to see at a glance what should be happening at any point during the project. Let me give you a practical example. In a health education program implementation, you might have bars for curriculum development, staff training, material printing, site preparation, and program delivery. The Gantt chart shows you how these activities relate to each other in time. Can staff training begin before curriculum development is finished? The chart makes the answer immediately clear. Gantt charts are particularly useful for tracking progress. As tasks are completed, you can shade or color the bars to show what percentage of each task is done. This allows program managers and stakeholders to quickly assess whether the project is on schedule. Gantt charts work best for projects that have a relatively straightforward sequence of activities with clear start and end dates. They are less effective for projects where the relationships between tasks are highly interdependent, which is where PERT charts become more valuable. You will see that distinction come up on the exam. Now let us look at the other major project management tool you need to know, and this one handles the more involved projects. PERT stands for Program Evaluation and Review Technique, and it was originally developed by the United States Navy in the 1950s for managing large defense projects. Unlike a Gantt chart, which focuses on when tasks happen, a PERT chart focuses on how tasks relate to each other. A PERT chart is a network diagram where nodes, usually drawn as circles or rectangles, represent milestones or events, and the arrows connecting them represent tasks and their estimated durations. The key advantage of a PERT chart is that it shows dependencies. Some tasks cannot begin until other tasks are finished. For example, you cannot begin staff training until the curriculum is developed. PERT charts make these dependencies explicit. Now here is the most important concept in PERT analysis, and I really want you to lock this in. The critical path is the longest sequence of dependent tasks through the network diagram. It determines the minimum amount of time needed to complete the entire project. Any delay in a task on the critical path will delay the entire project. Tasks that are not on the critical path have what is called slack or float, which means they can be delayed somewhat without affecting the overall project timeline. Closely related to PERT is the critical path method, abbreviated CPM. While PERT uses probabilistic time estimates, which means it calculates optimistic, most likely, and pessimistic durations for each task, CPM uses a single deterministic time estimate. In practice, many health educators use elements of both approaches. For the exam, make sure you can distinguish between the critical path, which cannot tolerate delays, and non-critical paths, which have some flexibility. Once you grasp that distinction, you are in great shape. Understanding when to use a Gantt chart versus a PERT chart is important for both the exam and for your real-world practice. So let me help you see the differences clearly. Gantt charts display tasks on a timeline, making them easy to read and create. Most people can understand a Gantt chart within seconds of seeing one. They are best suited for simple to moderately involved projects where the primary concern is tracking whether activities are happening on schedule. Gantt charts excel at visual progress tracking because you can quickly see which tasks are complete, which are in progress, and which have not started. However, Gantt charts do not clearly show dependencies between tasks, and that is their main limitation. PERT charts, on the other hand, are specifically designed to show task dependencies in a network format. They are more involved to create and interpret, requiring an understanding of network diagrams and critical path analysis. They are best suited for projects where many tasks depend on each other and where identifying the longest path through the project is essential for meeting deadlines. PERT charts excel at identifying the critical path, which tells you exactly which tasks must stay on schedule to avoid delaying the entire project. However, they are less intuitive for tracking day-to-day progress. Here's a great practical tip for you. In practice, many health education program managers use both tools together. They create a PERT chart early in the planning process to identify dependencies and the critical path, and then they use a Gantt chart during implementation to track progress against the timeline. Both tools are tested on the certification exam, so be prepared to identify each one and explain its purpose. You have the knowledge now to do exactly that. Read the scenario stem aloud. Give students 30 seconds to consider options before advancing. The correct answer is B. The critical path is the longest sequence of dependent tasks. Path 1 runs through curriculum development at 8 weeks to teacher training at 2 weeks to program launch, totaling 10 weeks. Path 2 runs through curriculum development at 8 weeks to material printing at 3 weeks to classroom setup at 1 week to program launch, totaling 12 weeks. Since Path 2 is longer, it is the critical path, and the minimum project duration is 12 weeks. Teacher training has 2 weeks of slack because it only takes 10 weeks through that path.